Good afternoon, everyone. Thank you so much for joining us again for another wonderful conversation, getting to know our community, getting to know our community leaders. And today we have such a lovely representative with us, and I'm so delighted to serve in this role for Dr. Carlisle as his special assistant for community affairs. We have a big, broad, diverse community, and we're trying very hard to educate ourselves more about the diversity that we live with and celebrate. We are celebrating this month Asian Pacific Islander Desi American Heritage Month. And we hope that you'll have an opportunity during this month or whenever you listen to this, because it's recorded, to take time to appreciate the many, many different ways that this rich and diverse culture has influenced our society. Today's topic, in keeping with the theme, is celebrating the APIDA community. This will be a discussion on the contributions of the APIDA community to our society, the unique challenges faced by APIDA individuals, and how we can work to celebrate and support this diverse community. I want to mention, for those of you who are not familiar with the D being added to that phrase, that was added because it wasn't just Asian Pacific Islanders that we are celebrating. We're celebrating the diversity, the broader diversity of the community, including Southeast Asian countries, which have been so important in this country, as well as, of course, in their own lands. For many years, we were just API Heritage Month, and it took us 15 years to get that established, and then they finally added the D. So it's a journey. We're always on a journey to recognize the diversity of our community. We're fortunate to have as our guest Dr. Monalisa Siofele-Lolohea, who is program manager for Young People's Ministries for the California Pacific Conference of the United Methodist Church. She has served as a reverend in the United Methodist Church for decades and has experience bridging the gap between Pacific Islanders, Black, and Brown communities. So that makes her a very rare and wonderful member of the community, helping us all to learn more, know more, connect more in our diversity. Our recurring guest is here again today, Dr. David Carlisle, President and CEO of CDU. Dr. Carlisle is a board-certified internal medicine specialist and served as director of the Office of Statewide Health Planning and Development in California for 11 years under 3 different governors. Thank you both for joining us. I have some questions to get our conversation started. Time allowing, we will also take questions from the audience before we wrap up. So listeners, if something occurs to you, please indicate your question. Our attendees can ask their questions in the chat or tweet them with the hashtag, quote, CDU Community Forum, one word, CDU Community Forum, end quote. All right, let's start with our special guest, Dr. Siofele-Lolohea. Tell us about your role, please, in the United Methodist Church. Sorry for that long introduction, but we wanted to say who you are. Go ahead.
Thank you, Sylvia, and greetings to you as well, Dr. Carlisle, to our community at CDU for this wonderful opportunity. My name is Monalisa Siofele-Lolohea. I currently serve as clergy and as program manager for the California Pacific Conference of the United Methodist Church here based in Pasadena. I'm also the second half of a clergy couple. My husband also serves as a pastor for some of the churches in our conference here in Southern California, Hawaii, Guam, and Saipan. My role currently, which I'm appointed to, is I oversee the youth and young adult and youth workers programs for our conference. And that spans throughout Southern California and then throughout the Hawaii district, which also includes Guam and Saipan. I've served as clergy in our church denomination since 2014, but have served in all of the different capacities for over 22 years, working with youth and young adults, and just really bridging the gap between the local church, the districts, and also through our conference and national realm for our denomination. So it's a pleasure to be here this afternoon and to share this wonderful time and space of this ohana. So thank you for having me.
You must have started when you were 12.
As a PK, I'm also a preacher's kid, so I started, pretty young.
Okay, all right. Dr. Carlisle, as president and CEO of CDU, what steps are you taking to ensure that the university is a welcoming and inclusive environment for APIDA students, faculty, and staff?
Well, thank you, and it's great to be back with the audience again, Sylvia, and welcome to our webcast, Dr. Monalisa as well. I'm looking forward to our discussion. You know, I will say, Sylvia, that it starts with our vision statement. Excellent health and wellness, and I'll underscore the next, for all in a world without health disparities. And I bring this up because we tell our students at CDU that when you look at health disparities and when you look at under-resourced populations and kind of look at the nexus between the two, those issues are not limited, of course, to the United States. And this is why our students go to countries around the world, Zambia, the Philippines, Mexico, et cetera, because we want our students to see the entire scope of what it means to be under-resourced in healthcare around the world. And indeed, around the world, to be sure, many of these disparities or these issues with healthcare are related to disparities across different population groups. And I could go on, but when you look at the various Pacific Basin populations, this is certainly true and is part of the legacy of things like colonialism in the history of the world, quite frankly. So I just want to say, as we note Asian Pacific Islander and DESI Heritage Month, that students at CDU are fluent in these issues, and it's something I'm very proud of.
Thank you. Dr. Siofele-Lolohea, you have experience bridging the gap between different communities. How do you think we can celebrate the diversity of the APIDA community while also acknowledging the unique experiences of each subgroup within it? That's a challenge, isn't it?
Indeed it is, but I think I was so just pleased and grateful to hear Dr. Carlisle saying about CDU's mission and vision. And I believe that's something that, especially working with young people in the Pacific Islander communities that I serve in currently, and with the varied, DESI, I love that you guys added that, because even within our own denominations, there are groups that don't fully, aren't covered by the whole AAPI. And so having AAPDI, I really appreciated that, because we do have a lot of our Asian countries that aren't represented within certain acronyms or groups. But that is of a great importance, especially with this generation that I serve and work with, and still learning, coming out of the pandemic and still working through all of what we've gone through when people were left to learn how to communicate, especially with parents and children. It's been something unique where we're having to learn to rebuild, not just bridges, but to rebuild relationships, understanding the significance of going back into our cultural heritage in time when we have to learn to grow our own food, learn to eat healthier, make healthier choices. And that, I think, it also helps to align with everything that young people are going through. So that work that I currently do here in the church is something that we've realized it's not just a church situation, it's a community situation, it's cultural situation. And so just even changing language and viewing ministry in a different lens, I think has been really helpful, especially in this conversation. I feel inadequate at times. I'm like super excited to hear the scientific and the medicinal part of it, but I think that these conversations are so helpful, especially with the generation of now, when everything that our young people do requires social media, requires access instantaneously. And I think going back into a lot of our culture with the Pacific Islanders and the Desi and all of our ethnic folks is realizing that there are gifts that we've been given long ago, where we just take a moment to step out into the sunshine and bask in the sunlight, visit the ocean and take a swim, understanding all of those things. And then the ecology of it, I think, is one of the big things that is bridging the gap. Is the land and the countries and the places in which we live, they're not just ours, they're all of ours. And so in realizing the importance of taking care of that so that our generation can have something to pass on to the next. And so, yeah, there's a large scope in working with bridging the gap between our young people and our seasoned elders and those that have unique experiences. So I'm grateful for this time that we get to bridge this wonderful communities together and get to hear the stories and where we're connected.
You really make us appreciate the wealth and the richness of cultural history when we're just faced with the coldness of electronic media and communication by machines, when our elders have so much to tell us and to teach us and to ground us in such wonderful long histories. Dr. Carlisle, how can we work to address the language and cultural barriers that may prevent APIDA individuals from accessing health services?
Well, I think the one of the first important steps is just to recognize that these barriers exist. And there's no better place than to recognize the barriers and celebrate the diversity that the barriers kind of push against than being in Los Angeles, because LA is a fantastically diverse environment. And I think of all the various population groups in the world, especially in the APID category, you find everyone in Los Angeles and all the languages. So if you want to connect with the languages, if you want to connect with the populations, you don't have to go any further than our own backyard. And whether we're talking about people from Samoa and American Samoa, Cambodia, South India, you name it, all these populations are here in Los Angeles. And they all have their own unique languages. And as healthcare providers, it's important to at least, I think, indicate to a patient that you are respectful of their background, their diversity, that you're aware of their linguistic challenges. And you may not be fluent in any one language, but simply by kind of reaching out kind of halfway, that does a lot to provide patients of diverse backgrounds that we see in Los Angeles with an assurance that you actually do care about them and respect them.
That sounds very positive, but I wonder if we have sufficient participation and representation of APIDA individuals in leadership, both in the church and society as a whole, so that these issues can be brought forward. Is that a barrier, Dr. Siofele-Lolohea? Is that a barrier that we don't have enough people like you to help educate us and inform us about how we can best reach out and communicate and participate together?
I think Dr. Carlisle also just kind of tapped upon it. One of the gifts I think that all of us as human beings has is we have the gift and opportunity to get to know others. And I think he spoke about that just recently. It made me think a lot about situations where I went with my own mother, my parents, to say a visit to the doctor's appointments. And sometimes language is a barrier. But as children who are raised, we call it in the 2.5 realm, right? I'm able to understand what a physician is saying or what a clergy might be saying and then translate it to my parents. And I think that is a gift that we have as, for me, as children of God, and also as just representatives of the human race, is that we're able to get to know each other. As a clergy, I served in multilingual congregations where I don't speak Vietnamese, but we have a Vietnamese culture and the different Vietnamese language. But when I take the time to just learn simple greeting words that I can say to the people, when I take the time to sit and eat and taste the food that they make with their hands and their hard-earned money, I think that speaks volumes and begins to break down the barriers that we face in any situation. And I believe, especially in church or in the world in which we live in our communities, if we just take a moment to just recognize the humanity that we have with one another, I think that can then begin the relationships to really tackle these barriers that we can face, whether it's in education, whether it's in in medicine, whether it's in the church world or communities that we face, even in our political realms. I think that going back to those foundational moments of just getting to know, I am because you are, and you are because I am, and together, that's where we can really begin to break down these barriers that cause so much pain in our world today. And that's really also working with young people, what it's come down to. It's the relational part. You mentioned that as well about the technologies and things. A lot of our young people, they haven't had the opportunity to just sit and listen to the stories of our elders, the richness of the gifts that they had, the experiences, because we're living in a different era. And I think sometimes just being able to sit and listen to one another and say hello. When we share the word aloha, ha meaning breath, coming from the depths of your pico, the center of you. When I say aloha, I'm sharing my breath of life that I have and greeting you. And I pray that you can also greet me. So I guess that's one way that we can face these barriers in all the different places that we exist and live.
Can you just say that again? What when you say aloha, can you because we know that phrase, but I don't think I've ever heard you say what that really means, what you're really communicating.
Well, I'm grateful as I am an adopted child of Hawaii, born and raised in the island of Hawaii as a Samoan, growing up around many of my friends who are of Hawaiian descent. So understanding the word aloha, when we hear it and see it, aloha is actually a way of life. It's alo coming from your center and the center of you. So from the piko, what we call, and then ha, meaning breath. And so when we say aloha, I'm greeting you with the breath that I have been given this day, the life that I have received from God or from the creators. And when I say aloha, I'm also greeting you. So that's one way the aloha spirit is carried on by many of us who were born and raised in Hawaii. We continue to carry that aloha with us wherever we go. And it's very common in all of the Pacific Islander or Polynesian cultures. We have aloha in Hawaii, aroha in Maori for the land of the long white clouds, alofa in Samoan, and then we have ofa in Tongan. So, and some other of our extended families. So that's when we say aloha, it's not just aloha, it's aloha with all of me. So
That's beautiful, beautiful. Thank you for helping us understand that better. Dr. Carlisle, what steps can we take to increase representation of APIDA individuals in the healthcare workforce, and why is this important? Can't hear you. Can't hear you. I don't know.
It's important because of the diversity of the communities that we serve, especially here in California. If you want to be a healthcare provider in California, especially Los Angeles, for example, but certainly other parts of the state as well, it's important to be able to engage with every person from every population group in the region, because you never know when that engagement will occur. And you want to be able to offer that individual, when they come to see you, a connection, basically, and give them confidence that you respect them and appreciate them. This is why it's at CDU, we're very proud, I'm very proud personally, of the fact that in addition to being a historically Black graduate institution and receiving federal funding for that, CDU is also eligible to be designated as a Latino serving institution, and also eligible to be federally designated as an Asian Pacific Islander serving institution. I think we may be the only higher education institution in the United States, I say that cautiously, but we may be the only such institution in the United States in higher education. And of course, we're the second most diverse institution in the four-year not-for-profit world as well in the United States, second only to a university in Hawaii, ironically enough. But CDU, I think, kind of walks the walk of diversity, because that's the reality of the environment that we find ourselves in here in Los Angeles. And of course, to get kind of down to the important details, when you look around various population groups, every population group experiences challenges in the healthcare system, especially those groups that have where English is not a first language for many members, and many of those groups also have experiences with poverty and discrimination, and this is just a reality. And I think it's important for us as healthcare providers to be cognizant of the existence of these challenges as we interact and engage with the diversity of people.
I think it makes a tremendous difference. I used to work in a clinic that had very diverse populations, and the staffers who spoke the language and came from that community would often come forward and greet the patient with a special hello that was used in that community. And I thought just that simple gesture of welcome really made people feel that the place belonged to them. It didn't just belong to people who didn't greet one another in that way. So it's a challenge, but it's also such a lovely opportunity to get to know other people and other cultures. Dr. Siofele-Lolohea, can I ask you, in recent years, on a sadder note, there's been a rise in hate crimes against Asian Americans and Pacific Islanders. How can we as a society work together to combat racism and discrimination against APIDA individuals? It's a hard question, but I want people to be aware of this challenge.
Here in Southern California, a few of our clergy friends, especially with the rise of what's been happening in our AA communities, in our Asian American communities, many of them serve in bilingual congregations. So from the Japanese and also the Korean backgrounds, we've gotten together to even begin discussions. So they've invited several of us just because we've seen the rise in all of the crimes that are happening. And together we've kind of formed just to figure out how can we as just community leaders and people of faith, what can we do? And what we've been working on is just reaching out to many of the policymakers, community leaders as well, and invited them into conversations. What is it that we can do just by beginning in our own areas? How can we make things a little bit safer, or understand the laws and things like that? Because many of our communities that we serve and face, they don't really know the legal side of things, right? And many of them don't want to take any legal action if something were to happen because of the ramifications from those reportings. And so we've been learning about many that have gotten either threats or have been hurt, but never reported anything. And so I think that there's a large number of our communities, both in AAPID, that don't report a lot of it. And so we're just trying to hear stories right now and trying to get the community, like you said, build a relationship so that we can have them tell the story and what's happening, and then work together to let each other know that we're not in this just in our own groups, but that we're in this together to form a safer place. And then also to find the resources so that we know who to turn to, so that we can either have some policies created and in place, implemented, both that can help many of the seniors or those that are getting targeted. And then that's where we're just starting. And this has been about 2 years now in the making in our own faith communities that I've known. It is true, and LA has such a richness of diversity. And sometimes that's the biggest gift, but it's also the challenge. And so really understanding how to navigate through all of our different groups then also becomes one of our big hopes that we can work through together. So that's how we're starting.
I wonder, Dr. Carlisle, if our students might not help with that by interviewing members of the church and making a record to share with lawmakers so that the situations with API communities are more visible than they generally are. That would be a very good assignment for our undergraduate or our graduate students in nursing or in medicine or public health, because both sides would benefit from knowing more and knowing what the opportunities are through health education to help communities facing some of these problems. So this might just be the beginning of of a relationship where we learn more from you and your colleagues about how we can be helpful as an institution to community members. Let me see. Let me ask a further question to you, Dr. Siofele-Lolohea. As a member of the clergy, how do you think faith communities can play a role in promoting diversity, equity, and inclusion? I think we touched on that a little, but are churches better at advocating for that than some other institutions? If so, why? If not, why not?
I think our church is better. I don't maybe wholeheartedly agree with that. I think that there's challenges that we face as well as faith communities. But I think that the partnership and collaboration, how you just mentioned, is key in moving forward, in understanding and helping one another, especially because you have experts in the medicine field that can help and to understand. And then we also have an understanding of the faith communities. I think about, as a graduate, I graduated from Claremont School of Theology, and today we had the final celebration on the current campus here in Claremont, and we were preparing the newly graduated class of 2023 to go out into the world. And many of them have struggled in these past 2-3 years with a lot of their congregation members that have gone and suffered through mental health breakdowns, many of the health issues and things. And we're no experts in that field. But I think when we can connect and collaborate with partners like CDU and others, I think it's only then that we can really begin to tackle a lot of these issues, because we are able to work together. And I think as clergy, that's one of the biggest things. We don't always like to ask for help, because many people seek help spiritually or mentally with many clergy. And so there's this facade sometimes that many of the clergy go through, saying we have to be strong, we have to deal with this, but I believe that we also need someone else to talk to, that way our mind, our body, and our spirit can be aligned to continue the work that we do. And so I think it's only in collaboration, it's only in partnership with others that we'll be able to move forward and really diversify all that we do and share. So yeah, I don't think the church can do it alone. I definitely don't believe that, but with the help of others, together we can.
Well, Dr. Carlisle, don't the healers in medicine need healing sometimes as well?
Absolutely. And, you know, all healers are people as well. And so we are the patients and the providers simultaneously. And that's a reality of being a healthcare professional.
Dr. Siofele, as a member of the clergy, how do you think faith communities can play a role in promoting diversity, equity, and inclusion? Is that something that you know, we're all God's children, but we don't really enjoy the kind of equity, diversion, and inclusion that we would all hope for. Is that something that the faith communities feel they can help take on, or is that really the domain of other parts of our community?
No, I believe that's a big part in what we do as well in the faith communities, and especially in our denomination, California Pacific Conference, for the United Methodist Church here that I serve and work in. We have a large group of folks that continue to serve in social justice and compassion ministries, which is a big part of our work in working with community members. And especially right now, since the ending, we have a lot of our border ministry workers that are there, our faith leaders that are at the helm, providing support, providing the care to the extent that we can. But there's only so much that we can do as well. And this is where we are really reaching out, I believe, to others, to partners in any capacity, that as beloved children of God and as the beloved community of humanity, that we should be able to support those who are in need, and so there's a lot of care that's, required and that can be supplied. And as faith leaders, we can only do so much. But I think this is also where the partnership can come in, where we not only partner just of our own, but with you at CDU, with those in community groups. We work a lot with Face LA. We work a lot with many of the LA Voice and those types of groups that have been at the forefront of many of the issues and injustices that are caused, and just really try to bring solutions and to the problems that we're currently facing. And this is something that we're currently doing in our faith communities, that it seems brand new, but it's really not. It's just that we've been fighting in different ways and understanding things from a different lens. So now we're working together with those that are in the realm to educate many of us that don't understand what happens in those areas. I don't know if that helps bring some light to that.
No, I think we can probably learn a lot from each other.
Definitely.
Yeah. Dr. Carlisle, the COVID-19 pandemic disproportionately impacted APIDA communities along with other communities of color. What have we learned from this, and what steps can be taken to avoid this happening again? I hope COVID has given us some roadmaps. Has it, that if we find ourselves in this situation again, we're at an advanced place from where we started?
Well, Sylvia, you mentioned the violence against the Asian Pacific Islander Desi American community that has occurred in conjunction with and due to the COVID-19 pandemic. I do want to recognize and acknowledge for the audience, in case they don't know, that violence against our Asian Pacific Islander Desi American community is not new at all. In fact, it's part of the historical quilt of Los Angeles, and that's the reality. In 1871, there was a massacre of Chinese American individuals in what is now called Chinatown in Los Angeles. Many people lost their lives. This is part of our legacy, and it's an example of how that legacy perpetuates itself today. When I was talking about COVID-19, one of the quotes that I used was a statement by a young man that he made just before he passed out as he was being beaten. And his statement was, "I am not Chinese." And fortunately, he recovered from that. But I think it just shows how the complexity, the heterogeneity of all of our populations is so easy to overlook. And when you can look beneath the sort of stereotypical or cliched surface, you can appreciate the nuances of our communities. And to be sure, when you look at the Asian Pacific Islander Desi American community and look at how the COVID-19 pandemic has impacted that community, the reality is it impacts or impacted that community in different ways, depending upon which components of that community you're talking about. And so when you look into the variety of the different populations, you see different types of risk factors for COVID-19. International travel versus being a healthcare worker versus being an employee providing a public service where you don't have a chance to go home. These dimensions manifest themselves differently across different populations. And part of the complexity of our reality is kind of appreciating the nuances about how these complexities manifest themselves. So yes, this is what makes Los Angeles and California interesting. And I don't want to say this is a metaphor because it's not a metaphor. It's actually reality itself that we're talking about. And this is something that we all have to embrace as healthcare practitioners.
Sad but true. We have a comment that just came in from one of our listeners. He said, "We have politicians now who want to return to a time when various groups were denied their identity after fighting for decades to gain them. I'm tired of the fight," he says. So we make 4 steps forward and then we apparently take 3 steps back in some situations. And it is exhausting, but hopefully our children are picking up the mantle as some of us get longer in the tooth, and they will carry on. Dr. Siofele-Lolohea, may I ask, as a Pacific Islander and a member of the United Methodist Church, what challenges have you faced when trying to promote intercultural understanding and cooperation? And how have you overcome these challenges?
Well, some of the challenges that we and I still currently face, many of it are systemic challenges, things that have been implemented long before I ever became a clergy member. And as a clergy woman, it's still very recent in our denomination. We've only been able to get ordained in the United Methodist Church for a little over 50 years. And I think some of the diversity, much of the system that currently exists was made specifically for the dominant culture at that time, which is non-ethnic, I would say. And so I think within that, and I serve on different groups within the United Methodist Church at the conference level. I serve under the Connectional Ministries team. Our executive director, Erin Hawkins Smith, has been an amazing leader. She serves alongside our bishop. We have a new bishop who is Bishop Dottie Escobedo Frank. And I think that within our denomination, having leaders that have the foresight and the heart to know that there is a great amount of work and of breaking down the systems that have been in place and that have held many, just many from excelling in all of the gifts that they have been given. Recognizing that and being a part of those teams and at the table with those leaders has given me much hope that there is still much work to be done, but we now have those that are in place that can help the work get done, if that makes a good statement. For me,
isn't it like taking on an extra whole layer of work in addition to the faith work that is challenging by itself? To,
as we say, we count it all as faith work.
I see.
In the sense, and you know, and I do believe it is for me in my line of work as clergy and working with young people, and especially as an ethnic woman clergy. I believe it's definitely not just for myself. I have been able to get to where I am because of those that have come before me. And because of the shoulders that I have now stand upon, I'm able to sit in a place and or be invited to even speak at the table where we
Uh-oh, you froze. Well, you've frozen for the moment. I think our technical staff will help us get you back. Let me turn to Dr. Carlisle while we're waiting for that. One of our listeners says, Dr. Carlisle, what advice would you give to APIDA medical students who are headed toward a career in healthcare or medicine? I hope you're not frozen also.
My anti-mute space bar was not very well. There it goes.
Okay.
But anyway, well, the first bit of advice is the same advice that I would give to every aspiring medical student and aspiring healthcare professional, which is to say, you know, keep on pushing, and be tenacious, and don't give up. And remember that everybody I know who's a health professional has had to get back up when they've fallen down at some point in their career. I think that's very true. The other thing I would say, though, is it's important to recognize that there's a lot of diversity out there, and I serve on a state board, the California Healthcare Affordability Board, and one of the first points that was made in our first meeting was made by Dr. Richard Pan, a former state senator, and he said, just remember, we use the term Asian Pacific Islander, but it's as an all-inclusive term. But he said, recognize the diversity in our populations, appreciate it, and speak to it, because it's important to recognize that not everybody is the same as everyone else, even within the slice of the pie, basically. And I think that's an important message also, because for students in this population group, they come from so many different backgrounds. Some of them are very wealthy. Some of them come from families that are very, very poor. Some have been refugees themselves. Others are sons and daughters of refugees. And there are amazing stories and backgrounds. And I think demonstrations of courage that exist that are literally within the hands of one or two generations. And I think this is a reality that that it's important to be aware of in healthcare education and in healthcare in general.
A student is asking, Pacific Islander community is often overlooked in conversations about diversity and inclusion. How can we work to raise awareness of the unique experiences faced by Pacific Islanders? Dr. Siofele, is it different? Is it different being a Pacific Islander from other API populations? And is that message getting across?
I think that many, for the Pacific Islander communities that I've served and I'm a part of, it's understanding living in a bicultural world. For many of us that are born and raised in America, I think we're still part of the youngest groups of immigrants that have come, where our parents have been here. Even if, I believe here in California, the Samoan community has been here for a very long time. And I would say those that have come with that group have been able to live in a different era where, many have acclimated to the culture and to the ways of living and ways of life. But I think that there's some that really are learning to speak beyond the cultural barriers, because even within their own barriers, it's very hard for many of the PIs to speak up. And I just encourage, many of the young folks that I serve and work alongside, is that their voice matters. Understanding that and respecting that as well, just as if we were learning to share our culture with anyone, just being present, and also realizing that you have an opportunity just like anyone else. If we are here, especially in California, there's such a richness that we have opportunities left and right to be a part of conversations, to be present where you don't see a Pacific Islander or a Desi student or person. Be that one voice that represents yourself, and knowing that wherever you go, you're carrying your heritage, your culture with you. And so even in that understanding, be a representative that shows all the goods that come with it, because there's enough challenges that we face even without speaking. And so I always love to share, to take every opportunity to extend not just the aloha and the alofa, but when you are in areas that they don't know, share. Tell the stories of where you're from. And that's the only way that others will get to learn more about you, and that your voice can start to be heard. So yeah, I highly encourage that.
I used to work in a multicultural clinic, and the main icebreaker was always diverse food. We were always willing to eat somebody else's version of whatever it was, and to learn how to make that. And it just broke the ice, because there was that common love of eating delicious things and learning about new delicious things to eat. But there's so much more, of course, than learning about the food. But you have to begin at a small step, we found, and that small step really led to bigger ones, where we really did learn about diverse cultures. What role, let me stay with you for a moment, what role can faith communities play in promoting social justice and equity? Is that something that the churches are taking on more today, or differently today than they used to?
Speaking just from the California Pacific denomination, and I think some of our friends also, I have friends that serve in the Disciples of Christ denomination as well. I think many of them have been taking more of that social justice and compassion work, because we see that it really, the work of the church is no different than the work of the body of the people that we serve. And so that's been something that has been at the forefront, as I shared a little bit earlier, with many of the church and faith communities opening their doors and understanding that, we can't just depend on others to do something. We have to take the initiative to do the work ourselves as well. And so understanding that and educating a lot of our folks that faith work is work that is on different realms. And so I think that's something that's been really important. In our denomination, we work closely with Reverend Denise Barnes and also Reverend Dr. Joel Hortiales. They are two of the ones that currently serve on our social justice, compassion, and border ministries. And just understanding the realm of work that they do really helps us to get a better understanding of what's needed and the support that is needed, not just from APIDA, but from all of the different groups that currently exist within our denomination. So, yes.
Thank you. Thank you. Dr. Carlisle, we really have enjoyed an exploratory conversation today. Do you think there's a way for us to continue the dialogue? The diversity in the API community is so large. There's so many different perspectives, points of view. It's not a monolithic community at all. And do you think we could take a role as CDU in educating our staff and our students who are not API to know more, to learn more, to experience the warmth and experience of the leadership of our speaker today and her like? I think it would open doors and would help them in treating the diverse clients that they have.
I would say absolutely so, Sylvia. In fact, I'd say that we're already doing this to an extent, but we can always do more. One can always do more. And we're already doing this because we are designatable as a Asian Pacific Islander, is a federal term, serving institution of higher education.
Which means we have enough volume to do
yes,
that.
we have enough diversity. We have a high enough percentage within this particular, again, slice of the pie, federally defined, to qualify. So this is already part of the fabric of the CDU community. And of course, issues of diversity are part of our origin story at the university. And this is something we practice every day. We can always do a better job. But I just want to invoke the memory of our faculty member, the late Gus Gill. And many people remember his name, many others may not. But one thing about Dr. Gill is that he was, and I know him very well at the time that his passing was approaching. He interacted a lot. And he was a bona fide person of the world. And we had many conversations about countries and populations all over the world. And he knew what he was talking about. And I appreciated that in him because he also reflected the African-American community that is our founding legacy at this university and defines our existence as a African-American, historically Black university as well. So this is CDU. And I'd say that we are on the leading edge on this particular topic among institutions of higher education throughout the entire country, but not just throughout the entire country, but even here in California, we're on that leading edge. Because again, there's no other institution that walks this walk like we do. But again, we can always do more. And whether it's making a trip to the Philippines with our nursing faculty, or a variety of other circumstances, this is something that I think defines our university. And it's why the word diversity is one of our university values.
Well, this has been an important dialogue with both of you for our listeners, and I want to thank our listeners for being here today as we continue to outreach and help you get to know in the audience the wonderful people who are here in the school and who are in the community leading, helping us to be more healthy, to work together, to help one another be more healthy, and to stay connected through forums such as this. So again, I thank you and I remind you to share and interact with our forum on social media by using the hashtag CDU Community Forum. Help us get the word out. We would appreciate that because we want as large an audience as we can get to contribute to these conversations. Bookmark CDU Community Forum page on the CDU website to get a heads up on our very special next guest for June. And I look forward to seeing you then. I wish everyone a happy and healthy day. Thank you again for being here.
Thank you.
Thank you.